Thank you, Madam Speaker. I will yield 3 minutes to my good friend on the Energy and Commerce Committee, Mr. Burgess of Texas.
The gentleman is recognized for 3 minutes.
And I thank the gentleman from Kentucky for yielding. Madam Speaker, I ask unanimous consent to place into the record a letter submitted by the members of the House GOP Doctors Caucus. This is a letter
I'm sorry, the gentleman's request will be covered by general leave.
This is a letter that explains how the health care policies included in the Inflation Reduction Act would affect American patients. There are 21 healthcare professionals who signed this letter. It's remarkable that none of our concerns were considered, all were ignored, not only as members of the House and Senate, but as healthcare professionals as well. The point of the letter is that this legislation will do the exact opposite of what the Democrats intend. Unfortunately, the legislation will kill research and development, reduce quality of care, and threaten patient access to life-saving drugs. Under this legislation, we're going to see changes to Part B drug reimbursements that will lead to an average of a 40% cut for healthcare providers, doctors, who provide care to Medicare patients in their office. Currently, Part B reimbursements for administering drugs in the physician's office are a calculation based off the average sales price plus 6%. Now, under this new system, Part B payments to physicians are going to be calculated off of the maximum fair price. Attractive term, but no one knows what it means because it is yet to be determined by whom? The Secretary of Health and Human Services. And we've all seen how trustworthy they have been over the past 2 years. So the current 6% average sales price add-on payments to physicians that the doctors have come to rely on now to run their practices will be based off a significantly lower government set price versus the traditional market-priced ASP. This results in significant lower payment to physicians. Now, Wednesday afternoon late, out in the Rules Committee, I offered an amendment with Dr. Murphy to fix this problem. Unfortunately, that was rejected on a party line vote. These payment cuts threaten the sustainability of medical practices and will lead, let me say that again, it will lead to physicians closing their doors. And when practices close, the patient need does not disappear. Care will then shift to hospitals. This will ultimately lead to an increase in healthcare cost, a decrease in the quality of care provided, and will limit access to treatments for patients across the country. From experience working in private practice, I can attest that there are significant consequences of consolidation. Here's the bottom line. Democrats are using Medicare as a piggy bank to pay for other things. What other things? Oh, like subsidies to insurance companies. They want to reward insurance companies and punish doctors. It makes no sense. This legislation will do the exact opposite of what Democrats intend. It is going to kill research and development, it is going to reduce the quality of care, and it is going to threaten patient access to life-saving drugs. As the most senior doctor in Congress and someone who deeply cares about the well-being of American patients, this bill is anti-doctor and anti-patient. We will live to see the consequences of this after final passage. I promise you that. I yield back.
I reserve.